Welcome to West Fargo Animal Hospital.
My name is Dr. Amy Anderson, and I am a veterinarian and owner here at the West Fargo Animal Hospital. What is a day in the life of a veterinarian like? It is important to note that no 2 days are ever going to be the same. That's what I love about this profession. If you're the kind of person that really needs the same thing day in and day out and you thrive on routine, this might not be the profession for you. But if you like excitement and always different things to see and different things to do, this is it. So the first thing that usually happens when we open up in the morning, everybody gets prepared for the day. The phone starts ringing off the hook with questions, emergencies, appointments, and that is our reception staff and front desk staff getting it all together. And then the doctors start getting prepared for their surgeries, wellness exams, and the day commences. So first thing in the day is usually to see wellness exams, and so this is one of our exam rooms, and this is where a lot of stuff happens during the day. Exams, emergencies, everything starts here. And then we also have a full pharmacy, so veterinarians and vet techs are also pharmacists and pharmacy assistants. This is where we have all the medication for the pets on hand. Anything we don't carry, we also can script through a human pharmacy. So human medications can be used on pets as well. Doses are very different, however. Then there's lab work to be done, lots of microscope work. We look at slides and blood work. All the vaccinations, things like that happen in here. This is the treatment room, which is where most of the procedures take place as far as the basic stuff that needs to be done for outpatient. This is our dental suite, which in some of the other videos you'll see it actually in progress, but digital dental x-ray, monitoring equipment. This table moves up and down for all different sizes of pets, which is super nice. And then if we go this way, this is our surgery area. It's the weekend, so everything's a little bit disheveled before Monday. This was the quietest time to do the videos, but this is surgery prep, surgical procedures in here. Then we have x-ray and ultrasound in this room. And during the day, we will do all of this. There are 5 veterinarians here at this practice. At any one time, we will have 4, 5, 6 patients going on back here, 5 exam rooms full, so it gets quite exciting. And right here is our ICU and surgical recovery cases, so they're right in the middle of the treatment room, so everybody can see what's going on. Even though it's busy, these patients can be monitored constantly. This is our cat ward. And our resident kitty, Ruth, baby Ruth. She's not a baby, she's an old kitty, but she came into the pound and nobody wanted her, so we kept her. And this is just an example of where all the big dogs live when they're here for the day. So lots of runs and windows and light for them, but we're surgeons, pharmacists, internal medicine doctors, neurologists. So the education that would be required for becoming a veterinarian includes getting your undergraduate degree first, which is typically a 4-year bachelor's degree, and it can be very specific. So for instance, I went to Penn State and got a 4-year degree in animal bioscience, which is basically the same as a pre-med degree. However, you can go more generic too and just do biology or microbiology, which actually might be a better choice for a lot of people because it's very well-rounded and it opens you up to a lot of different careers. The more specific ones focus on making sure you get the prerequisites required for entrance into veterinary school, but as long as you talk to an advisor and let them know what you want to do, they should be able to help you to make sure you're getting those prereqs. However, really any college degree prepares you for veterinary medicine. So for example, in my vet school class, we had a lawyer, a career military man that started vet school at 48 years old, a librarian, an elementary school teacher, and then I think it was 2 accountants. So just because you didn't go with a science degree in the beginning does not mean that you're not qualified. You just have to make sure you hit the important points for application to vet school. After your undergraduate degree, then you'll start veterinary school, which is a 4-year program. The first 3 years are typically all in the classroom, and in between those years you'll be doing externships or starting in labs and learning all the procedures that you'll be using going forward. The final year of vet school, the 4th year, is completely clinical, so you'll be working in a teaching hospital situation, whether it's large animal, small animal, diagnostic lab. You'll at some point be rotated through all of that. Once you graduate from veterinary school with your DVM degree, that's Doctor of Veterinary Medicine, you'll be prepared to practice anywhere you want in any capacity. However, a lot of students, especially now, are choosing to do a 1-year internship, which is usually in private practice or a university setting. That just prepares you a little bit more for entering practice. And then after an internship, you can choose to go on to do a residency to specialize too. And that's very similar to human medicine, where you'll choose a residency in cardiology, neurology, orthopedic surgery, soft tissue surgery, and there are several other specialties that you can choose that are becoming more and more popular, and it's actually quite common for students to do residencies now. There are several licenses that will be required for you to obtain in order to practice veterinary medicine after graduation. The first and most important is passing the North American Veterinary Licensing Examination, also known as the NAVLE, and that is typically taken in the final year of vet school, so your senior year, and usually you'll have the results before you graduate, and that is the number 1 step. Then after that, you will take a licensing exam in each state that you wish to practice in. So for instance, if you're practicing in North Dakota, but you're living on a border state where you may be seeing patients in South Dakota or Minnesota, then you'll need a license in those states as well, or any other states you feel like you might be moving to soon or interested in. Any point in your career, if you move, you can retake the licensing exam in any of those states as well. Also, if you choose to specialize, then there'll be a specialty exam after your residency is over in order to get that specialty degree. And if you choose to do any alternative therapies like acupuncture, chiropractics, homeopathy, there are typically certifications for those as well. The average starting salary for veterinarians is typically somewhere in the range of $60,000 to $70,000 a year. That will vary depending on your location in the country. It will depend on extra certifications such as internships and residencies, your skills and confidence coming out of vet school, and just the general needs of the area. Currently, there is quite a bit of demand for veterinarians all around the country. So that means that the job outlook is good, and it's quite possible to make more than $150,000 a year in this profession. Typical debt after veterinary school is close to $100,000, sometimes much more, sometimes a lot less. So that is important to keep in mind considering what the average starting salary is. You want to give it your best shot at paying off your student loans as quickly as possible. So being frugal during school, paying attention to scholarship opportunities, and trying to minimize that debt when you're finished as much as possible is a very good idea. However, that being said, the profession is well worth it and extremely rewarding, so I wouldn't let that scare you. I also wanted to add, as far as what I mentioned with the job outlook for veterinarians, the outlook is really good. There's always a high demand for veterinarians, mostly because our country cannot produce a lot of veterinarians every year. When I was in school, there were only 23 veterinary schools in the entire country. Now there are a handful more, but still not nearly the number that we see of medical schools and other professional programs. So that means it is difficult to get into, but it's highly worth it. If you find that you're interested in veterinary medicine but don't feel like you want to interact with other humans all day or see patients like a typical stereotypical veterinarian would do, there are also a lot of opportunities outside of regular practice. We have university jobs, there are government jobs, so you can be involved in food safety and inspection, biological warfare. Homeland Security actually employs a lot of veterinarians. We're a huge factor in preventing biological threats in this country. And there are pathology positions where you can work in diagnostic labs. I wanted to take a minute to also talk about the opportunities in a veterinary practice other than veterinarians. We also have veterinary technicians, which is a fully licensed profession, and veterinary technicians are equivalent to human RNs or registered nurses. They are integral to a veterinary practice. There are treatment supervisors, there are surgical anesthetists, there are surgery assistants at times when needed. They play a main role in patient care during the day. They place IV catheters, administer drugs, help with all of the alternative therapies that we do here at this practice. So that is a great profession, and one that is very popular in the area, being that we have a really good veterinary technician program at NDSU. And that is, I believe, the only four-year licensed vet tech program in North Dakota. They produce amazing techs, and we have currently at this practice 9 licensed veterinary technicians. They also have to go through a national licensing exam and a state licensing procedure. And we love our techs. We try to only hire licensed veterinary technicians at this practice because the skills are second to none, and your salaries will be typically in the $25,000 to $50,000 range. It's a wide range, but there's a wide range of job responsibilities as well, and lots of growth opportunity there. So that is great. It is just a 4-year degree, so you don't have to worry about thinking ahead of 12 years of schooling and all these other things that you have to do. You can just get right to it right away. And there are opportunities for veterinary technicians to specialize as well. So if anybody is interested in more information about vet tech school, certainly NDSU's vet tech program is a great place to start, or we can here at our practice help steer you in the right direction as well. I also think it's important to note that if you start your career as a veterinary technician and then decide, oh, you know what, I think I want to go on to veterinary school, that is absolutely possible. In fact, I had several classmates in my vet school class that were veterinary technicians for a year or two, or even one of them for 10 years before they moved on to vet school. And it's certainly doable. And a lot of times those students that were vet techs beforehand are a step ahead when it comes to all the procedural things we learn in school.
West Fargo Animal Hospital actually does quite a bit of extensive dentistry. It's something that we have grown over the last 15 years. Veterinary dental care for your pets is extremely important. The health of the teeth and the gums affects the entire health of the body. There is really no way to thoroughly clean a teeth without them being fully anesthetized. When we do procedures, the first thing that happens once they're anesthetized, a full exam and charting of the mouth is done. So looking for pockets, gum recession, root exposure, all of those little minute details both on the inside and the outside of the teeth. We use an ultrasonic dental scaler to clean the teeth. Cleans very effectively up underneath the gum line. We also have hand tools if needed. We have a high-speed dental drill to make extractions easiest on the pet. The extraction sites are sutured closed and sent home on antibiotics if indicated and pain medication. And then we always do a recheck exam 1 week after the dental procedure just to make sure everything's healing well and looks like it should.
Pain management has really become a much bigger thing within veterinary medicine, so we know that animals feel pain and we need to treat that pain. They can't always express that they're painful. Using medications, supplements, and then our extra tools like laser therapy and acupuncture to control that pain is really, really important for them.
Veterinarians get to do a lot of really cool stuff. I have a lot of pictures over the next few minutes that I will explain. Most of it's surgery because that's my favorite thing to do, but there's a little bit of everything, and just be prepared. Some of it's a little gross, but that's why it's fun. So the first picture will start off easy. This is a normal dog uterus. It was probably a 6-month-old dog that I spayed, and the V-shaped part in the center is the horn, the right and left horn of the uterus, and then the body is at the very bottom. And the 2 balls at the top are the ovaries, the right and left ovaries. This is normal. This is not normal. This is why we spay a dog. So this dog has what's called a Pyometra, which is an infected uterus, and that whole tubular structure are the 2 horns of the uterus that you saw in the other picture. This is about 20 times the size of a normal uterus, and if we were to open it up, it would be filled with pus. It smells bad, it's infected, it's terrible, and dogs don't need their uterus unless you're going to have puppies, which we really don't need lots and lots of puppies in this world. So that's why we spay them. If they don't get spayed, this can happen, and it becomes a life-threatening situation. It's sort of like operating on a water balloon and really needing that water balloon not to burst inside their belly. So here's another fun slide. I'm just easing you into the grossness. This is dog vomit here on the side. It's gross. This dog actually got into an Easter basket while the family was away, and in that basket included Peeps and chocolate and jelly beans and all kinds of grossness, and she thought it was really awesome. Our job is to make sure the chocolate and everything else in there doesn't make her even more sick, because chocolate can be toxic to dogs, especially in large amounts. So what we did was we gave her a medication to make her throw up, and she evacuated her stomach, and that's a close-up there in the corner of the gelatinous, marshmallowy Peep chocolate vomit. Vomit's something you're going to see every day at a veterinary hospital. So you get used to it after a while. Some of it's more gross than others, and some you can really find fun things when they throw up. I mentioned earlier that veterinarians wear a lot of hats or have a lot of specialties all rolled into one. So as a general practitioner, you're an oncologist, a dermatologist, and that's where this slide comes in. This dog, it had a very interesting skin condition that caused him to be mostly bald, and he never really got most of his hair back, but I just think he's the funniest looking dog ever. And my favorite part is this dog's name is Donald Trump, and I'm sure you can all imagine how he got his name. I've had the privilege over many years of being at the West Fargo Animal Hospital to care for all of the canine officers from the West Fargo Police Department. And this one here is my favorite. He was the original. This is Disco. and I cared for Disco from the day he first got here to North Dakota, and I still care for him now. He's retired now, but doing really well. And this was partway through his career where he started suffering from some malformations along his spinal cord that was greatly affecting his work. He was painful, he had difficulty jumping, and these dogs really are incredible athletes and need to do some pretty amazing things. So when they're sore and they're painful, they can't always do their job really well. Disco, we did diagnose with some spinal stenosis. He had a lot of nerve issues, and I did not do his back surgery, but with the West Fargo Police Department and his handler, Officer Nielsen, we got him referred to a specialty practice in the cities that did spinal surgery on Disco, and we helped with his recovery. He did amazing. He went back to work within 6 weeks and continues to do very well to this day, and this has been several years ago now. So it's really fun to be able to work with the community and care for the animals that are working for us as well. So like I said, most of these pictures are surgery pictures because that's what I love to do. This particular patient, just as an example of how tiny we can go in surgery, this kitten was, I believe, 4 or 8 ounces, so very, very tiny, still needing to be bottle fed, but this poor thing was born with a very large hernia, an inguinal hernia in its groin, and the intestines were actually under the skin all the way down to the kitten's kneecaps. So something had to be done, and we did anesthetize this kitten. That was a little bit sketchy on how we were going to do that, but we got it done. We kept it warm. We did the surgery, and the picture in the center, bottle feeding this kitten, was within probably 20 minutes after the kitten woke up from surgery. It was hungry. It let us know it wanted to eat, and it did great. So that's another really rewarding thing we got to do. Just in the picture, the other person in the picture, this is Kendra. She's a licensed veterinary technician, and you can see she was mostly the anesthetist while I was the surgeon in this case. This is a fun picture because it gets a lot of reaction. It's pretty gross, but it's a common injury that we see. This dog has what's called a proptost eye, where basically his eye has come out of the orbit, out of the eye socket, and it's from a blunt force trauma injury. This dog was brought in pretty promptly. We were able to save the eye. At this point, when the eye's out this far, it's only held in by blood vessels and nerves. All the muscles holding the eye have to tear in order for this particular picture to happen. But we were able to replace the eye back where it was supposed to go, and then we sewed the eyelids shut for a few weeks, and they do really well. He kept his eye. He could see fine. You'd never know what happened. This is another dog that had an eye surgery due to glaucoma. I like this picture because it's kind of fun. This was actually one of my technician's dogs, and we decided that we could not save the eye. It had to come out because it was a chronic source of pain, but her son was devastated by the thought of her dog losing its eye, and he told me the only way that I could remove the dog's eye was to make it a cool eye patch. So I did my best for the eye patch. He thought it was pretty cool and really did well with the dog after surgery. This is just an example of what the skin will look like when an eye is removed in a dog. And these pictures are really fun too. We see a lot of hunting accidents, probably not as many in Fargo as when I used to work in rural North Dakota. That was pretty much all day, every day at this time of the year down there, but we still see them here. This dog was a long-term patient of mine. The owners went out hunting. His dog jumped in the ditch and came up with a little tiny drop of blood at one nostril. He maybe heard a little yelp, I think he said. Dog had one drop of blood, nothing seemed out of the ordinary. So they finished their day and went home. And then the next morning, when the dog woke up, it acted like it had a terrible, terrible headache. I can imagine he did. And the owner said he'd try to pet him and he'd shy away and move his head. He didn't want to be touched. So we brought him in, and he pretty much acted the same with me. I didn't see anything unusual. Nothing was swollen, but he did not want me to touch his face. So we chose to anesthetize this dog and investigate a little further. And we had this scope that's in the picture. We put that in his nostril, and I could see a little piece of wood there. And I assumed that he had maybe inhaled a wood chip or, piece of plant material. So we got out our forceps, and I attempted to pull on that little, what I thought was a few millimeter piece of wood. And when I got a hold of it and pulled, it just kept coming and coming and coming. And this is actually a piece of a cattail, and the dog jumped right on top of it so that it literally went straight up his nose, practically into his brain. I mean, he just missed his brain by millimeters. We pulled that out. You can see the only amount of bleeding was that little bit on the gauze in front of his nose. And this dog was fine and did great, but was quite a surprising find on that day. As veterinarians, we do a lot of cancer surgery. And so this is just an example of one surgery at our hospital. This was a fairly old dog, a Springer Spaniel. I think he was 13, that had a known tumor on his liver, and the owners had decided they didn't want to do anything about it. They knew it was there. They just wanted him to live his best life, and when the time came, they would make that decision to euthanize if needed. However, the time came, this tumor burst and the dog was bleeding into his abdomen, and the owners said, we want to redo. We changed our mind. We want you to save our dog. So into emergency surgery we went. He was bleeding into the abdomen, so we had a lot of free fluid. This is the small part in the center of the picture. Is a lobe of the liver, and the very large, round, almost heart-shaped mass is the tumor on the end of the liver. And so that was quite large, and we removed that whole liver lobe. This is the tumor, and then the small part at the bottom of the picture is part of the liver lobe. And this is the dog 2 weeks later, so he did great. That is why I love surgery. A chance to cut is a chance to cure, and this dog was cured. He lived several more years after this. He was, I think, 17 when he finally passed, and that was very cool. Here's just another example. This one did not turn out so well. This ended up being an exploratory surgery. We knew there was something pretty major going on in the abdomen, but from the x-rays and the ultrasound, we couldn't quite tell what it was. And if you look at this picture, the reason we couldn't quite tell what was going on is because this dog's stomach, liver, spleen, and small intestine were all wrapped up together in this large tumor. And unfortunately, this was inoperable. We were not able to save this one, but the owner had closure because he knew exactly what was going on, and he knew there was no other choice to make. So we were able to at least allow this dog not to suffer anymore. This is Gus, and Gus is, I believe he was a large lab, and this is a tumor on the skin. So that large dome-shaped mass in the slide on the left is the tumor with half of the skin on it on one side, and the other half of the skin was removed as we were dissecting it. And then that other picture is just my hands holding the tumor. That I don't remember how much that weighed, but it was several pounds, and the dog practically listed to the left when he walked after that because he was so used to compensating for that weight. It took him a few days to get used to it, but another good outcome. He did really well. Orthopedic surgery is also a very common aspect of veterinary medicine. And while we don't actually do orthopedics ourselves here at the clinic, aside from splinting, x-rays, diagnosing, we have visiting surgeons that come to the clinic to perform these types of surgeries. And this particular case was Wonder. And if you look at her forehead, you'll see that super distinct W on her forehead. That's how she got her name. It's actually Wonder Woman. That's her proper name. She's now my kitten. She was brought in by the West Fargo Police Department on the 4th of July a couple of years ago because some people at an apartment building were sitting on their back porch and they heard a meowing garbage bag inside the dumpster not far from their porch. They investigated and found this kitten inside a pillowcase inside the garbage bag in the dumpster with a broken tibia and fibula, so complete tib-fib fracture. She was really tiny. I think she was only about 3 or 4 months old at the time. And so a friend of mine who does most of our orthopedic surgeries came over and because she was so little, we couldn't put implants in there to stabilize it. So he did what's called an external fixator. Some humans get those quite a bit too. Maybe one of you guys have had it. It's a little cage with pins that stabilize the bone. And we used like a plumber's acrylic on the outside to keep it together because most of the fixators are too heavy for this little girl to drag around. So she had that on for about 6 or 8 weeks to heal her leg. She did awesome, and that was a really fun one for us. And now she's running around my house somewhere. Foreign body surgeries are probably the most fun. Sometimes you know what you're looking for and sometimes you don't. So this particular dog came in obviously vomiting, and in my hands there you can see that that's a loop of small intestine with kind of a funny shape, almost looks like an M or maybe a 3 on its side. And so we did surgery, we explored, and the greenish material is the foreign body that's coming out of an incision in the small intestine. And it was a number 3. So this was, those foam bathtub letters that little kids have that stick on the side of the bathtub, and you have the whole alphabet and numbers. And this dog decided to eat the number 3, and it didn't make it all the way through, unfortunately, and so had to come out the other way. What was fun with this was because these guys are foam, the letters are foam. On the x-ray, there was a really distinct gas pattern in the shape of a 3. I actually thought it was a W when I saw it inside, but turns out it's a 3. This particular kitty was another fun one. This cat had a tendency or liking to eat his owner's hair bands, hair ties, and a lot of cats do that. A lot of owners always say, "Oh, I thought they were just playing with them," but many of them ingest them as well, and these things are not very digestible. This cat had actually been eating hair ties for at least 4 years when we finally had the opportunity to go in and do surgery and remove them. He had had multiple wellness exams where we could feel something in his belly, and we actually thought he had a tumor. They, for whatever reason, declined diagnostics until one day on another wellness exam, they said, "All right, go ahead and take an x-ray." And these things are quite easy to see on an x-ray. And this cat went to surgery, and we pulled out, I believe the final count was 27, 28 of these hair ties. Some of them were the normal size ponytail holders, some were the headband size ones. So he did an amazing job. This cat did awesome after that. And now they periodically bring him in for x-rays because they are worried that he has more in there, but he never has at this point. The next few slides are some videos of removing the hair ties in surgery. This is a 4-month-old Great Dane that ate his, I believe, the daughter's teddy bear in the family. She'd been missing it for a while. Dog got sick. We knew from an x-ray that there was something obstructing. And I always think this is a good one for Halloween because that picture of that teddy bear just really kind of creeps me out. But what made it even better, because this is a puppy, puppies commonly get worms as well. So not only did we get the teddy bear, which is still looks evil, but it's cleaned up a little bit more, we got a lot of roundworms that got to come out with this as well. So that's really kind of gross, but we just cleaned his intestines out from the inside out this time. So this picture, this series of pictures is fun and one of my favorites. It was a 6-month-old Beagle puppy that liked to eat items in the home. It got sick. Nobody could figure out, and nobody knew anything that was missing. We could tell, we could actually feel through his belly that there was a very firm tubular foreign body in the intestinal tract. And you can see between my hands in the picture on the left, the distended, really angry loop of small intestine. And then on the right, we pulled the foreign material out of there. It was fabric. And so one of the fun parts of foreign body surgery is washing it out and figuring out what it is. And let me tell you, you find some interesting things sometimes. Sometimes it's kind of hard to explain to the owners as well. This one was more fun than anything, but the moral of the story in this case is teenagers, clean your rooms, or the unmentionables could end up on the desk at your veterinarian's office. So this was one embarrassed teenager, an embarrassed mom, but puppy was good. Everybody keeps their floor picked up now. So I had to include this picture just to make a point that even though we're veterinarians and we're professionals, we make mistakes sometimes too. So the cat that's in this photograph is stuck between my storm door and the front door of my house. That's this kitty right here. He's kind of cranky, but he's here for the video tonight as well. The kids left for school one day, and in the chaos of the morning, Marvin somehow managed to get himself lodged between the front door and the storm door, and nobody knew it. We all went to work and school. The FedEx man dropped off my blue apron box on the porch and then gave me a call while I was working to find out what he should do about the cat that was stuck between my front door and my storm door. He didn't want to let him out because he was afraid he was going to run away, so I quick hopped in the car and ran back to the house to release him. And it took him a long time to forgive us for that one, but we all make mistakes.